today. So our first speaker today is Charito Gailling, and she is the project manager with the Population and Public Health team at the BC CDC. And she supports provincial initiatives to promote healthier built environments. Working within the complexities of upstream prevention and population health, Charito's approach is strongly collaborative, and she works with a web ally in regional health authorities, community planning and local governments, academic researchers, and community-based organizations. She coordinates cross-sector partnerships and learning opportunities, including the BC Healthy Built Environment Alliance, which involves about 130 diverse stakeholders from across British Columbia. To support evidence-based decision-making, Charito leads efforts to assess and synthesize current research on the health impacts of planning and design principles, most notably including the Healthy Built Environment Linkages Toolkit that we're talking about today. So without further ado, I'm going to pass you off to Charito.
Thank you very much, and it's such a to present at this webinar. We're seeing all the names pop up, and just fascinating to see people calling in from all over Canada. Thank you so much for joining us. I wanted to first let you know that Lisa and I are calling in from Vancouver, BC, and we would first like to acknowledge the land on which we are calling from within the traditional territories of the Coast Salish peoples, including the Squamish, Tsleil-Waututh, and Musqueam nations. We're grateful to have the opportunity to work within this territory. I'm going to advance the slide here. So for our presentation today, I am going to just whip through the Healthy Built Environment Linkages Toolkit. That's a new version was launched in May, just a few months ago. I'm going to introduce new content, particularly the considerations of practice. And then I'm going to pass you on to Lisa and Jennifer, and they're going to talk about practical applications. They're going to offer you two examples of how the toolkit has been applied for community planning. Lisa's going to talk about how Fraser Health Authority has applied the toolkit, and then Jennifer's going to talk about her experiences working with an official community plan in the city of Abbotsford, which is in the Fraser Valley here. We're going to end by suggesting concrete actions that public health professionals and local governments can take, and then we're hoping to reserve about half an hour for questions and discussion. And that's the part that we're really looking forward to. I have for the next slide the polling questions. Terry, should I just go through these questions, or do you want to?
And you can go through them, and Jamie will be bringing them up.
Okay, thank you. So we wanted to find out a little bit more about who we're talking to, who's in the virtual room here. We're going to ask you to fill out 3 short polls. The first is, which province or territory are you calling from? And if you could just click on there, let us know. I think it's just 50 seconds to populate. That's fantastic. Looks like lots from BC here, and as well as Ontario, and sort of scattered around to the rest of the provinces and territories. Does everyone see the polling results, or should I let you know what the numbers are?
I believe everybody can see it because it's showing last results.
Good. Wait a little bit more. Looks like all the numbers are in. So yeah, so we've got 25% of folks from BC, about 32% from Ontario, and a few folks, 9 to 6 folks from New Brunswick. That's fantastic. 14 from Alberta, and yeah, a good representation of Canada. Thank you so much. The next polling question, we'd like to know what sector do you represent, because we're hoping that the toolkit applies to diverse sectors, planners, academic researchers, public health professionals, private sector. Please just select the sector that you represent. Fantastic. Lots of health professions. And about 8-9% from local governments. same for community organizations, a little bit less for academic researchers. Fantastic. We've got a few folks from the private sector and the provincial governments. Wonderful. Thank you for that. That just helps us know what you might be interested in. And the last question is, to what extent do you collaborate with other sectors on healthy built environment initiatives? So we'll let you self-define what collaboration means, but we're interested, do you never, rarely collaborate, every few years, sometimes, a couple times a year, or often, 3 or more times a year? Wow. That's fantastic. Definitely the majority of us here in the room often collaborate more than 3 times a year with other sectors, and we love to see that. You're going to hear us talking a lot about how important collaboration is for us, especially for complex issues like healthy built environments and social determinants. So that's wonderful to see. Thank you very much. Okay, so I'm just going to speed along here. We wanted to start by just bringing up this one graphic from the Canadian Medical Association. Many of you, since you're well-versed in collaborations with built environment, you've probably seen this before, but we love this slide. What it shows is that over 60% of what makes Canadians sick or healthy is related to your life or the environment. These are social determinants like income, social exclusion, employment, working conditions, community belonging, and we wanted to just point that out because in recognizing that social determinants have a greater impact than the healthcare system, which is noted at 25%, we recognize that if the things that determine the health of populations are factors outside of the healthcare system, then as health professionals, any actions that we take to improve population health must address these social determinants, and it's so important that we work in close collaborations with other sectors that also have influence and a role to play. So for us that promote healthy built environments, we focus on how the built environment and health intersect. And so our efforts are to bring together partnerships primarily between health professionals and organizations, local governments and private sector planners and developers, and academic researchers. Those are the 3 groups that we focus on. And as part of this collaborative approach and to help us navigate our complex work, we really prioritize an equity lens in order to recognize how different service populations and socioeconomic groups may be differently impacted by planning and design solutions. I wanted to, in case you're not familiar with what the health authority system in BC looks like, I just wanted to share with you this map showing that there are 5 regional health authorities in BC. Along the right there, you'll see the color-coded. And there's 2 provincial health authorities. I'm from the BC Centre of Disease Control, and that's one of the collection of agencies that belong to Provincial Health Services Authority. And here in BC, each regional health authority has a healthy built environment team. These are located within environmental health and primarily made up of environmental health officers or public health inspectors, as they're termed in other provinces. These teams range in size from 1 to 6 staff, and if you're interested in knowing more about those teams and how they've evolved over the past 10 years, there's a report that we've just published that archives the evolution of healthy built environment teams in BC, and that's available on the NCCDH website, and I'll give you the formal title of it at the last slide. So a large part of health authority participation comes out of these healthy built environment teams, but of course other health professionals are very much involved, including medical health officers like Lisa, dietitians, population health teams, healthy community teams, and project managers like me, etc. Provincial Health Services has one healthy built environment lead, and that's me. And I take on a supportive and coordinating role, so I harangue all the partners. I generally am pushy. I push things forward. I just help to keep the provincial partnerships moving forward. So I provide project management support. But I want to qualify that this is very truly a collaboration, and I really rely heavily on the content expertise of the of our regional health authority partners and other web of stakeholders. So people like Jennifer and Lisa are the content experts, and I really rely on that as we bring together built environment partnerships. So to support cross-sectoral collaborations, we have the Healthy Built Environment Alliance in BC, and this is a voluntary network. It includes over 130 members. Like I mentioned, we focus on bringing together partnerships between health, planning and design, academic institutions, health researchers, and there's also a number of other partners, like mostly nonprofit organizations. And our purpose is we learn together. We have a quarterly speaker series to learn, develop shared concepts and shared approaches around how we can work together to forward healthy built environments. And the Linkages Toolkit was initiated from the Healthy Built Environment Alliance, and they continue to play an oversight role to continue its updating every few years. There's a smaller steering committee on the Built Environment Alliance that represents about 25 different organizations who come together more actively to drive the vision and to oversee the things we work on together, like the toolkit. And THSA plays the role of the backbone organization, so that coordinating role. The steering committee is super engaged. It's a very positive and mutually supported group. Our members have a high level of expertise in their field, and I have to say it's one of the highlights of my job to be able to work with these women and men on the Built Environment Steering Committee. It's a really great group. Lisa is on the steering committee, and Jennifer was one of our co-chairs just until recently. So what is the Linkages Toolkit? So we consider this a foundational resource. It's the instrument we use to collect key research findings about how planning and design relate to health. So within the toolkit, there's various tools to support users that are newer to built environment concepts and those that want to do more detailed research analysis. It offers a conceptual framework to start conversations about the built environment. So it tries to define, what do we mean when we say healthy built environments? What are the components of that? It's a quick reference to general principles of good planning and design that are broadly supported by health research. Oh, sorry, I just saw the time notice. I'm going to speed along here. Those are the fact sheets. That's a quick reference. It's a roadmap to research findings that associate specific planning and design interventions to various health outcomes, and those are the evidence diagrams that we call them. That's my favorite part of the toolkit. It's based on a synthesis of research findings from multiple fields of study. So the key messages within it are they're quite high level and generalized. They're pretty much common sense things that align very closely with general practices of good planning and design that planners already use. But the value is that it is evidence-based. So the content and key messages are based on broad literature reviews, the guidance of content experts, and a grading criteria that is pretty rigorous. So you can rest assured that if something made it into the toolkit, the quality of the research that backs it is pretty strong. So the toolkit, it offers a rationale for why it's important to think about the built environment when we think about population health, but I want to qualify that it doesn't go into the how to apply it. And so there's a huge amount of other great resources that are more about practical application that we'll offer a few of them at the end of this presentation. So the 5 components of the Linkages Toolkit, we call them features, are transportation systems, neighborhood design, housing, food systems, and natural environments. And so the toolkit, as I mentioned, everything is based around these 5 features, and it outlines and describes various planning principles that are backed by health evidence that relate to each of these features. I think, just considering the time, I've only got a few minutes, and I'm just going to really quickly show you each of the tools visually. This is a summary. It's a high-level summary of each of the features and the associated planning principles. There's about 3 to 4 planning principles each. One new thing in the revised version is that we identified 3 considerations for practice, we call them. that includes social well-being, economic co-benefits, and considerations for small and medium-sized communities. So there's a section in the new toolkit that go more into what are some considerations related to that. And these are things that were prioritized based on user feedback and evaluation of the original toolkit. And there's things that have implications across all 5 of the. This is an example of a fact sheet. So as you can see, there's key messages here. This is an example of neighborhood design and planning principle 1, which is create complete neighborhoods through mixed land use. And there's all sorts of health benefits related to physical activity, reduced vehicle use, and walkability that you can go into more if you read the toolkit. The summaries of research links, these are high level, it just gives you an entry point into the body of research, which is very vast, multiple fields of study. We try to synthesize it by showing how specific planning principles are related to intermediate impacts on the built environment, which are therefore correlated with specific health outcomes. So because there's not a lot of research that links directly from planning principle to health outcomes, we thought it was important to show that this intermediate impact, and that's the pathway of research associations that show how population health is impacted. So the evidence diagrams, if you really want to get into the research, this shows a weighted associations between planning principles, impacts, and health outcomes that are weighted. So you'll see there's different weights of research links. The bold gray line there shows a strong strength of evidence, that there's a lot of evidence to show, for example, social well-being increases when walking also increases. There's some moderate research links that it just didn't make the criteria, but we thought it was, it's still fairly well established in the research. And if you're interested, I can share more about what the grading criteria that we use in. If you're interested, just give me a ring and I can chat with you about that. There's also new research areas, and we wanted to include that because for our partners in academic institutions, these are the things that there is some research out there, but it may be contradictory or maybe not enough research, and these are areas where we see potential for more research to add to the evidence base. So the considerations for practice that we included: social well-being, economic co-benefits, small and medium-sized communities. I was going to go through and tell you some specific quantitative outcomes that we identified in these considerations of practice. I'm being told to wrap up, so I'm sorry I can't get into that, but you can maybe review the slides and see where those snippets of strong research links that we associated with these considerations are, and we'll come back to it maybe in the discussion as well. So I'm going to pass it on to Terry to introduce Lisa.
Thanks, Charito, and sorry for rushing you along. I just want to preserve that for our question period at the end.